Good afternoon. Welcome to another live session with me. Last day of this week, even though this week has been a bit of a roller coaster, isn't it? So there were certain things that we were not able to come online every day. But whenever we are, we try to give the maximum for all of you. How are you all doing? All are doing good? Were you all eagerly waiting to see whether today I'm going to come in front of you or not? So welcome to Neethu's Academy live reading with me, Vinod James. Okay. Jobita, good afternoon. Very, very, very good afternoon to all my lovely students. So how have your week been this week? How was your week? Did you all study? Did you improve? What happened? Tell me. Susmita Thomas, good afternoon. Jobita, how am I? I'm doing excellent. Thank you very much for asking. Hope you're all doing well. How have your week of study or the journey of your reading with us this week been? Soni Raju, good afternoon. Manju Matthew, good afternoon. Very, very, very good afternoon. And so happy to see a lot of people have at least one icon next to their name. If you have not yet liked our page, if you have not yet subscribed to our channel, if you have not yet followed our page, please do not hesitate to follow so that you will not miss any of the insights that we are going to come up with. And also please understand that our next regular batch, we have regular as well as crash courses available. So our next regular batch is only available from November, December and January. Karuna Kumari, good afternoon. Gina Johnny, how am I? I'm doing excellent. Thank you very much. Sapna Damodar, how are you? I'm doing good. Thank you very much. Mamta Malik, good to see you. Good to see you all as well. Krishnendu Nair, good afternoon. So happy to see all those warm queries that you're asking. So much happy that I'm coming in front of all of you. And what Neethu's Academy offers? Neethu's Academy offers you an array of linguistic exam training. So if you want to get more insights about it, please do not hesitate to contact the number that is there. They'll be happy to assist you. Liji Thomas, good afternoon. So if you are an aspirant to go to Ireland, there is another exam which you can take apart from the present one that you are there. There are n number of options available, so do not hesitate to contact those numbers. They'll be happy to let you know what are the other exams that you can take. Vidya Abhi, good afternoon. Lancy Matthew, good afternoon. Niji Reston, hi sir. Very, very, very nice to see all those lovely names. Anybody who's attending the live for the very first time, please do let me know. And also where you're from. Okay, it's not for any other reason, just to add on to my known people list. Known people list is always, increasing on a daily basis because I have people across the globe now where I can say I have known people there. Sanita Sabu, good afternoon. Anu Saban, good afternoon. So if you have not yet liked our page, please do not hesitate to like, because that's the only way where you can show us the support. Do subscribe to the channel, do like the channel, do follow the page that you're watching. And also, if you feel that this class that I'm taking, the link that has been shared to you, if you think that it is beneficial for you, please do not hesitate to share on your social media platform, because if you share, there are n number of people who are still unknown that we give a lot of free classes like this, so they can also be benefited. Tintu Manu, good afternoon. Although there are a lot of new names, but nobody have told me that you're new. Is there anyone who's attending the live for the very first time? Anybody like that? Yes? No? All of you are there before. Jinsi George, good afternoon. Very, very, very good afternoon to all my lovely students. As students are piling up, Suman Rangi, good afternoon. Jasna Jose, good afternoon. First time attending reading. Thank you very much, Jasna. May I know where you're from, if it is okay, yeah? Suman, yes. Okay, fair enough. Good, 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 good. So happy to see a lot of known people, new people. Suman Rangi, I'm attending for the very first time. Suman, may I know where you're from as well? Annie Verghese, hello sir, good afternoon. A very good afternoon to all of you. It would be nice to add on to my known people's list, because as of now, the students who attend the live are from different parts of the world. Of course, there are from different parts of India, Nepal. Jasna Jose from Thrissur. Okay, thank you very much, Jasna. There are people from Sri Lanka, there are people from Maldives, there are people from Pakistan, Afghanistan, Israel, different parts of Middle East. Annie Verghese, happy to see you again. Happy to see you all as well. Anu Joseph, good afternoon. Suman Rangi, I'm from Haryana. Am I happy? I think you're the first person from Haryana. So I have another known person from Haryana now. Okay, good enough, good enough. Thank you. Shinas, good afternoon. Then we have people from Malta, we have people from different parts of Africa, we have people from Singapore, we have people from Malaysia, Philippines, we have people from, of course, England, we have people from, I know so many, no worries at all. I have very much, I try to think, but I was not sure where you were from. Yeah, thank you very much for letting me know as well. Thank you. So Suman from Haryana. Kalai, good afternoon. Then I have Jasna from Trichy today, who's new, attending for the very first time. Then we have people from Australia and New Zealand. We have people from different parts. I can't just randomly remember. Okay, that's how. Annie, I'm from intensive batch. Thank you very much, Annie, for letting me know. Anu Dilip, good afternoon. So good. So I'm happy because every time when I do a live, I always think how many of you are new. So today also, thanks to courtesy of Suman and Jasna, there are two new people who said one, Suman is from Haryana and Jasna from. Yes, Kalei, yesterday we had few technical difficulties where we were not able to come in front of you. Really say sorry for that. Okay, Jisha Abraham, good afternoon. Niji Restinam from UK. Okay, see, that's another prominent place that all of our students are really looking forward. So Niji from UK, Karuna from Muscat. Very nice, very nice. Ramya Umesh, good afternoon. So see how diverse our classroom is, isn't it? Even though it's a virtual reality, you have people from every different parts or every nook and cranny. Jasna, I know you're a student of introductory, fair enough. So thank you very much for all those lovely details that you've said. Thomas Joseph from UAE, Dubai. Okay, I have another person known from Dubai. I was there last time. Next time, I have one number of people to meet. So really looking forward to meet you all there someday. We'll never know when it is. Kalei, I have a doubt. Why do people attend from UK? Kalei, please do understand there are n number of factors that students are there because they might be visiting UK with their family members. They need to have job. They need to apply for PR. N number of reasons. Okay. So Anju Suresh, good afternoon. Tahira, good afternoon. Jija, good afternoon. And a student who's attending doesn't mean that they are attending because they want to settle in UK. They are looking for migration to another country. They can take these exams. So, because they want to clear OET exam. Okay. Fair enough, Mamta. Vinod Jo, good afternoon. See, it's not about why do they attend because there are n number of reasons that they can attend. Okay, so we're not here to judge anyone. We are here to just aid all of you to reach to your dream country. Okay, right. So are you all ready for today's session? Yes, if so, give me a very quick thumbs up. Let me see how many of you are ready for today's session. Nobody ready? Everybody ready? See, I want you to start commenting, okay? Because the more you start interacting, the only way that I could literally feel that I know that you're there in front of me, but literally if I communicate with you, that's the only time where I know that you're there. Anu Joseph, G Jajobi, yes. Niji Restin, yes. Very nice. Mamta, easy, sir. Okay. Kalai, ready? Okay. Mamta, you want me to make it easy? I'm here to make you all easy to go and crack your exams. Jobita ready, Jinsi George ready, Anju Suresh ready, excellent, Karuna ready, Karuna from Muscat, is it? Yeah. Ashmi Shagar, good afternoon. Danya Jens, ready. Okay. Mamta Malik, yes, ready. Fair enough. Good. Manju Matthew, ready. Tahira, ready. Excellent, excellent, excellent. So as you have all, Anu Dilip, ready. So I see Anu Dilip has number one, icon next to her. So there are few who haven't still liked our page or followed us. Please do not hesitate to do that, because that shows the support that you are rendering to us. If you really look into our Telegram page, which we have just pinned, see, we have about 50,000 and plus students who was there in our. So that is because of all your love and affection. That's the support that we need. So it's what we request you. If you have not yet followed our page, if you have not yet liked, if you have not yet shared our page, please do this, so that all the students are also getting benefited and they know that. Divya ready, Dia ready, Savit ready, Danya ready, Lancy ready. Okay, as you have all said that you're all ready. Now, the first thing that we will be doing is we'll be having a part B question which will be there on the screen, and you'll have 2 minutes. Timer will be there. Your job is to find an answer on or before the time ends. And if you're finding it before, no problem. Don't type the answer. Just tell me a thumbs up button or say done. That's all what I need. Because if you type the answer, the other students are not going to be of benefit. So we are here to be of mutual benefit to each one of us. So do not type the answer. I'll ask you when to type the answer. That time you can type the answer. Now the question will be coming up on the screen. As soon as the question pops up, do not worry about, just start doing as you do on the day of exam. Listen, all Manoj, good afternoon. So if I missed your lovely names, please do not think that it is deliberate. It's just because a lot of names pops in between. So there you have the question. Please do the material and then we will discuss. All right, time I've just alluded. Is it just in time or on time? Anu Saban was the first person to say that. Done on or before time. How about others? Did you all manage to find an answer? In between, there were few. Ashmi done. Neena Jomun, good afternoon. Savit Biju, good done. Mamta Malik done. Ashmi, yeah, okay. Jija Jobi done. Soni Raju done. Okay, so few of you have done on time. Danya Jin's done. Karuna done. Sumirangi done. Haryana. I'm just trying to, repeat so that it just gets into me. Zobita done. Anu Joseph done. Aziz John done. Jinsi George done. Kalei done. Susmita done. Okay, fair enough. Niji Reston, UK done. Okay. Manju Matthew done. Annie Varghese done. Vinod Jo done. Diya Thomas done. Anju Suresh done. Okay, good enough. The people who respond is also every time increasing, so I'm happy. Binsi Sudhish done. Vidya B done. Christy Paul done. Excellent. So as you Adishna Sanindran done. Alright, as you have all said done. Now let's go and see how to find the answer and what are the things, whether your answer is right or wrong. So before going into the answers, please do let me know what is your answer and how you got that answer. How is very important. What is the answer? How you got the answer. Angel Ernest, done. Angel Ernest. Vague memory about that name, but I can't remember where you're from. So there you have the question on the screen. Can you tell me what is your answer and how you got that answer? That how is very, very, very important for us, because once you tell that, then only we can tell you whether what you have done is right. Absolutely good enough. If you have gone wrong, that is our responsibility to correct you as well. So please do comment what is your answer and how you got that answer. Let me see. Okay, Kala is saying B from middle of the paragraph. Okay, fair enough. Now I have the first point or first answer on the screen, B on the middle paragraph from the middle. Jija Jobi is also saying B from last para. Okay, fair enough. Jinsi George is saying B from middle to last. Manju Molanis is saying B. Anu Subhan is saying B from middle para. Susmita Thomas is saying B. Okay, so it's only B as of now. Ashmi Sagar is saying B from the fourth line. Okay, fair enough. Manju Matthew is saying B from last para. Niji Restin is saying B. Soni Raju is saying B. So everybody is saying B. Savit Biju is saying B. A and C is eliminated. Okay, fair enough. Anju Suresh is saying B from to last. Binsi Sudhish B, middle of the para. Ani Varugi is B. Vinod Jo B, middle para. Aziz John B, illustrate that lower gabapentin can also cause adverse effect. Okay, fair enough. Thank you, Ajish. Very kind of you to give me an explanation about what exactly it is. Okay, fine. Anybody? See, I want all of you to comment. Why? Do not worry about if they are saying that I have got this. Don't worry. I have not told you what is the answer. But if you have an answer, anything, whatever is your answer, just be proud enough to say. Danya Vishwambi from last part. Susmita Thomas, gabapentin was discontinued and the lower proximity enema improved. Okay, fair enough. They didn't tell a rare case. Fair enough, Niji. Good enough, good enough. Okay. I think all of you have given, I'm not saying all of you, most of you also I wouldn't say, but yeah, those who have told me, I always appreciate a student who has the courage to tell whatever is your answer, how you got the answer. Okay, good enough. So few things just to add on to as a reminder. When you're doing Mamta Malik B from middle and last, okay, fair enough. When you're doing part B, see, you get only after they take the part A material. Okay, when they place part B and C together, there is no separate time. B and C you have to manage together. Suman Rangi, they didn't talk about rare cases. Okay, fair enough. So when they do give that, you have to manage time. So part B is considered to be smaller, where you are expected to finish it in 10 to 12 minutes because it's only 6 questions. And these 6 questions will be from 6 different focuses. So let's see. When you're doing part B, the strategy changes because it's a different kind of question. Read the question, underline the keywords of the question, understand the question. Okay. Once you do that, then you're going to do a thing called elimination. Now, elimination is the most appropriate and the most easiest thing to find the right answer. I'll show you how. Now, when you Gopal Das Adhikari, Calcutta, no, I remember. See, these are my, I'm trying to recall. Right, now let's go back and see how to do part B. So in part B, I told you, read the question as you're reading, underline the keywords in the question, understand the question. So here clearly says, the case study gives information. So study information. Those are my keywords. See, your keyword should be stipulated to 2 or to an extent of 3, not more than that. Okay, don't write big, underline big sentences. Now see, after this, you have 2 options. One, you can read the answer option, underline the keywords in the answer option, then pick it up from the passage. That's what I do. If you want to read the passage and then pick an answer, that also is a possibility. There's no hard and fast rule. Now, what are my keywords in my answer option? A rare case of bilateral lower extremity edema in young patients. So, rare young patient. Young are my keywords. So, option B, that talks of the effect of the lower dose. So talks effect of low dose gabapentin therapy. And then option C, worsening condition and management. So worsening condition and management. After doing this, you're going to go and read the paragraph. Do not skip anything. Read everything that is given. So here the heading doesn't give you much info because it clearly says it is a case study. So a 46-year-old man. So do you think that there is an young patient? So that way I can straight away eliminate it because it's not talking anything about a young patient because this is a 46-year-old man. The case study is about a 46-year-old man. So old male with a past medical history of schizoaffective disorder and chronic lower pain was admitted for management and worsening depression and anxiety. He started on gabapentin 300 mg twice daily for his back pain anxiety symptoms. His only other medication was hydrocodone. After next few days, he started developing bilateral lower extremity edema. So what happened? After taking this, he started developing this. He did not have any cardiovascular related symptoms. Physical exam was only significant for 3+ pitting edema, with all laboratory values and imaging being unremarkable. Gabapentin was discontinued. Now what happened when that discontinued? What has happened? His lower extremity swelling improved. That means it became better over subsequent days. Then what are they saying? So it talks about the effect worsening condition and managing. No, when they stopped it, they're saying it got better. So it is not something. Again, I can literally eliminate. So I have eliminated the 2, but let's see where they're talking about. The incident of pedal and edema with gabapentin was used is approximately 7 to 7.5%, where all studies being in elderly patients. So again, this is a straight eliminator because all those things are in elderly above 1200 mg per day. This case illustrates that low dose gabapentin can also cause this adverse effect. So that means they're talking about the effect of the dose, low dose. Okay, it is important to recognize this adverse effect because gabapentin is used in conditions like diabetic neuropathy, which is associated with multiple comorbidities, and they can give rise to bilateral leg swelling. Presence of gabapentin induced leg swelling can thus confound the clinical picture. So that gives them the most appropriate clinical picture. So from here till until neuropathy and swelling, it is talking about the effects of low dose gabapentin therapy, and you can easily find the answer because the other 2 has been eliminated and you never had any other answers as an answer. So congratulations to all of you who got B. Your answer is right. Now, is there any doubt with regards to what I've explained or anything that with regards to why that answer came? If you're not sure, please do clarify. If not, we'll go to the next item. Any doubts? Any doubts with regards to the question? Kale is enjoying, happy, good enough, keep it up. Any doubts? So as you can see, we do a lot of linguistic exam training. So please contact the number so that they will give you explanation. Tahira, clear, very nice. Anusaban dancing, keep on dancing. Why not, isn't it? It is your achievement. Gopal does, no doubts. Okay, fair enough. Jinsi George is also dancing. Excellent. So as you've said, there is no other doubt that going to Vidya be clear, Anju Suresh clear. Good explanation. Thank you very much, Anju. Very kind of you because you are our adjudicators. So whatever that you feel is what are all like those accolades for us. You know, it's like that important all of you are. So let's go into the next part. Suman Rangi, they'll explain. Thank you very much, Suman. I feel that you don't have any doubts. So let's go into the next part. So next part is part A. So part A, generally, please be aware of it. See, on the day of exam, again and again, I tell you this is because student doesn't understand the importance of it. Okay, when you go on the exam day, when they place the part A material in front of you, do not touch the material, do not peek through the material, do not touch the pencil, don't look here and there. They might not publish your result. When they tell you to stop, please stop it. Okay, if they find that you are even writing after they have told you, they might not publish your result. So be cautious with that. Kalai immunothrombocytopenia, Jovita, same little tricky material. Jinsi George, tricky. Okay. So how about others? I want all of you to tell me how you felt about today's part A material. Because from your valid comment, Neethu madam will make the next material. So please be kind enough to tell us how you felt about today's material. Mamta Malik easy. Okay, fair enough. Kalai tricky. Okay, so tricky, easy. More into Gopal Das is saying easy material. Okay, fair enough. At least let us know how you felt. And I hope all of you have taken the printout. You have done the material in a paper, pencil used way. Sagar, easy. Okay. See, this Brad Wolf and all. Okay. These kind of, unethical people are always there. Okay. With who is here to, like rip other people's, they are those kind of, what can you say, money ripping, good for nothing people, absolutely here for ripping somebody else's money. So if you find these kind of unethical people, just report them and then ban them. That's all. Okay. So do not go behind these kind of, people who are here with no use at all. These people are just absolutely, feeding on, I call them leeches. I can't use any other unparliamentary words in here, isn't it? So there are people who would contact you for such unethical things. Just report them and block them. That's all the best that we can do. Anusaban is also saying tricky. Susmita felt a bit tricky. Okay, fair enough. So as we have got few, not all, but okay. So let's go and see what the material has in store for us. So the material will be coming on the screen and you can always, look into the screen. So what are the things? When you get that, start 15 minutes. So in that 15 minutes, what are you to do? So what are the tricks? What are the strategy? We have done an exclusive video in the previous thing. You can go back. And see, generally students have a doubt on the aspect of where you can find the answers. You can find the answers no matter whatever that we have done. You can find the answers on the very same page that you are watching, because it is all there. Okay, you can go back and to see on the day, it will be there, or the very close by areas, it will be there. Right, when the material comes on the screen, then we will start discussing. So as you have said, it is easy, tricky and all those, so it's a mix generally, but we feel that it is a what do you call, tricky one. Let's see. So what are the things that you have to do every time I do a part A? So today I'm going to show you how to do part text B, sorry. So we have 15 minutes, 20 questions, so roughly about 45 seconds per question. So can we take about 5 minutes to skim? No, the maximum time you are taking to skim is 1 to 2 minutes. That means, or an ideal one is 15 seconds per text. So when you're skimming through, you should be able to differentiate what is text A, what is text B, what is text C, what is text D. So if we can do that, why? Because part A is about time management. Now if you want to manage time, 1 to 7, if you are skimming as proper, 1 to 7 answers is just a piece of cake. You just have to refer. I'll show you why. Now before going into, let's say, text B, what are they saying? Now I'm just going to show you how to do skimming. Symptoms ITP are the bleeding problems with a fluid plated than normal. Symptoms include bleeding than usual, bruising, purplish discoloration, purpura, condition the tiny round spots and the same rash and got petechiae, and bleeding under nosebleeds, bleeding on the gums, having blisters in the mouth. So in child's pee, urine, bowel movement system, stool, any bleeding is difficult to stop, heavy menstrual bleeding. So what happens generally, I can guess that text B is about symptoms of immunothrombocytopenia. So it's very easy for me to identify. Now after this, likewise, you have to go through. So diagnosis. So what are they going to talk about in text C? It is all about diagnosis. So what are they going to do? What is a doctor? What are the tests that they do? So complete blood test, blood smear, another bone marrow test, antibodies, so microscope, these are all things. Now in text D, there are two range, that means 2011 guideline and 2019 guideline among various factors. So after this, you're going to go to the question. So when you go to the question, in order to make you a bit more challenging or a bit more tense, 20 questions are divided into 3 types of questions. So the first type is called match the following question, where the question number starts from 1 to 7. These are all supposed to be by-hearted by you, even the instruction. So the instruction clearly says you are expected to write any of these letters only. Okay, don't write anything else, only these letters. Now why I told you importance of keywords. Okay, after doing this, you're going to go underline the keywords in the question. Reasons behind the bruising and purplish discoloration in the skin. Did I underline that? I underlined it very straight where? In B, didn't I? Because it is there. So if your skimming is proper, you really no need to go back and see there also, because all those other things are as such. So the answer is B. Now see, how can one evaluate the level of different components of blood? So where are they talking about different components? It should be there in any test, isn't it? So test is there in C. Is there in C? Yes, it is there in C, isn't it? How can you diagnose it? Because you can diagnose different components of blood are what? Red blood, white blood, platelets. So the answer is C. Now see, what are the consequences that may expect if the blood can't make clot? So consequences, where are they talking about all these consequences if they can't clot? So if they can't clot, they are only saying when your blood can't make clot, you may bruise easily, bleed a lot when you're hurt, start bleeding for no reason. So what are those issues? That is mentioned in A. Understood why keywords are important? Now see, which drug is used for making sudden decrease in platelets? So there is a small thing. Where are they talking about all these sudden decrease and all those things? They're clearly saying single dose IVIG or a short course of corticosteroids can be used. IVIG can be used for more rapid rise in platelets is required. So it's a very straight answer for D. Excellent. Consumption of which medicine may lead to decrease in platelets? So consumption, disease, it should be somewhere mentioned in C. So which is the thing which is mentioned? So medicines you are taking such as chemotherapy medicines or aspirin. So that is the one which is causing. So the answer is C. Another nature of immunothrombocytopenia doesn't go by treatment. So something which doesn't go by treatment. Generally it should be there as the normal entry. So I'm just writing A. Now let's see if it is there in A. In some cases, ITP goes away on its own with treatment. Other times, immunotherapy is a chronic condition, which means the symptom can be treated but not cured. So that is what the answer is. I told you to find it in A. Instances only require home management for immune thrombocytopenia. So where are they talking about home and all? Is there anything which is mentioned? See, a child with a newly diagnosed ITP with no mild bleeding may be managed at home irrespective of the platelet count. So the answer is D. Now I have wrapped up my 1 to 7 questions. Please be kind enough to tell me what are your total in the meantime. The next set of questions are starting from 8 to 14 and these are called short answer question. Why short answer question? The answer can be as simple as that of a word, numbers, a combination of both, or a short phrase. With the present exam, we will not have long answers. So be aware of it. Again, after that, it's the same strategy. Who else may attack platelet other than immune system and check through blood tests? So where are they talking about all these blood tests and all? Somebody is gonna attack. So you may also have blood tests to check if the antibodies or protein that attack platelets. So who else attack other than immune? It is the antibodies. You can write two answers. It can be antibodies or you can write proteins. Anything is okay. Which is the least preferred procedure compared to rituximab TPO? So rituximab TPO, I know that it is there in D. So which one is not least preferred? So that is where the answer should be. So rituximab is there. High dose dexamethasone may be used for treatment both or which are preferred over splenectomy. So what is the answer? Which is the least preferred? Splenectomy. splenectomy. Majority cases platelets are attacked. So even if you really be cautious about the previous sentence, here is saying other than immune system. So this answer should definitely be immune system, isn't it? So the same place it will be shown, isn't it? It is saying primary when your immune system attack the platelet 80%, 80 cases primary. So the answer is immune system. Very good. Which factor is kept regardless if the newly diagnosed child with ITP shows mild bleeding? So mild bleeding child ITP, where are they talking about? It should be in where? So child is there, ITP is there. Can we manage what? Platelet is the answer. Why? Because which factor has been? So the answer is platelet count. So what are circular colored spots in the skin that resembles a rash? So there are platelets resembles rash and all. So they are saying this is called petechiae. So Petechiae is the answer. Type of immuno, so which the platelet count is reduced due to underlying ailment. So ailment means condition. So there are types are only mentioned in A. So they are talking about underlying condition, chronic infection, blood, other platelet. All those keywords are there. So the answer to this question is secondary. secondary. So question 14. Who is responsible for sufficient making of platelets? So who is responsible for making platelets? So it should be there in C somewhere. Why? Because another test confirmed bone marrow test. It can show whether your bone marrow is making enough platelets. So who is responsible for making? It is the bone marrow. So I have completed the next set of questions. Now for the final set of questions, which starts from 15 to 20. And these type of questions are called fill in the blanks, where you are expected to fill the appropriate word to the appropriate blank. That's it. Don't add anything. If you add even a article, it can cause or make your answer wrong. So people who are having immune thrombin may develop dash in mouth, bleeding, gums. So where are they talking about all these symptoms? B, isn't it? So bleeding gum may also develop in mouth. So what are they going to develop? Blood blisters is the answer. BLOOD Question number 16. Being dash condition sign can be treated, not healed. So not healed means it is not cured. So I know that I have read it somewhere. Where did I read? It is clearly saying what? The answer is being a chronic condition, which means symptoms can be treated but not cured. So it is a chronic condition. So CHRONIC. The diagnosis of ITP is done by using dash physical exam and test result. Something is there. So where are they talking about all these diagnoses and how they are going to find? Should be there in C, isn't it? They're talking about diagnosis is there, test result is there. So the answer is medical history. So MEDICALHISTORY. In a dash test, blood is placed on a slide, viewed, don't played, the blood set. So where are the tests going to talk about? So the test is also there in where? In C. So it's clearly saying blood smear, slide, microscope is mentioned as paraphrase, the device, platelet, or the blood set. So the answer is blood smear. BLOODSMEAR. The penultimate question for this week. As a first-line pharmacotherapy, steroids given for less than dash days over the therapy. First-line treatment. So they are talking about. So it should be some figure, isn't it? So where are they talking about this figure? It should be there in B. So short course for steroid is less than 7 days preferred over IVIG. So the answer is 7 because less than is already there in the question. So 7 is the only thing which is missing. Excellent. The ultimate question for this week. Newly diagnosed ITP non-responders first time administered rituximab for greater dosage. So where are they talking about? The medicine again. So these medicines are mentioned in text D again. Why? Because all the other keywords, rituximab, high dose, dexamethasone. So the answer is DEXAMETHASONE is the answer because all the other keywords are as such mentioned. So I have wrapped my 20. It's high time that you start telling me. If you have any doubts, please do clarify. If not, please do let me know what are your total scores. Because I know you're all done. Jodita, absolutely good enough. 20 out of 20. Very, very good. Keep it up. Stunning. Any doubts? Please do clarify. If not, please do let me know what are your total scores. Mamta Malik 19. Very good. Excellent. Keep it up. Ravi Kumara, Tirunelveli. Good enough. Jinsi George 20 out of 20. Absolutely stunning. 8. Anu Saban 18. Good enough. Good enough. Manju Matthew 18. Excellent. Good enough. Keep it up. Jasna Jos Trichur 19. Excellent. Keep it up. Karuna 19. Very good. Keep it up. Tintu Srijit 19. Excellent. Good enough. Adishna Shashindran 18. Excellent. Good enough. Anu Dilip 18. Excellent. Good enough. Keep it up. Jinsi George 17. Good enough. Good enough. Good enough. Susmita 18. Very good. Keep it up. Anju Suresh 17. Good enough. Good enough. Keep it up. So I think you have stopped. John, absolutely good enough. 20 out of 20. Kalai 14. Do not worry. It's because you haven't underlined the keywords. So please do underline the keyword. We are all here to help you out. Do not worry. Do not feel sad at any given instant. We are there for you. Okay. Any other doubts? Anything that you want me to clarify before I end up today's session? I don't think you have any doubts. So it was a pleasure knowing you all, teaching you all, and couldn't ask for more because the support that you are rendering towards us is an absolute sana. So we're very, very, very proud to say We are so much obliged to each one of you. So thank you very much for giving us another lovely session, lovely week, and may God give you all a lovely weekend. I'm going to miss you all for the next 2 days until and unless I meet you all on the coming Monday. Adios from all of us from Neethus family. God bless you all. Take care.